Assistant Secretary for Public Health Services Team, ASEC Maria Rosario Verneri. ASEC will now deliver her message.
Good afternoon, everybody. We apologize for the delay in our press conference for today. DOH reports 10 new COVID-19 patients, cases up to 20. This is our update for today. The Department of Health reported 10 new confirmed cases of the coronavirus disease 2019 or COVID-19 on top of the 4 new cases announced yesterday, March 8, 2020. This brings the total number of confirmed cases in the country to 20. All test results from the new cases were released today after samples were collected on March 6, 7, and 8. The Epidemiology Bureau of DOH is currently conducting comprehensive contact tracing activities for these cases. DOH is also currently in coordination with concerned local government units and centers for health development for localized response and implementation of infection prevention and control measures. DOH has deployed additional surveillance teams to expedite contact tracing of the new cases. Rest assured that DOH is maximizing all channels, including coordinating with the Philippine National Police, other stakeholders, and government agencies to immediately identify and isolate, if needed, those who may have had contact with the confirmed cases, our Secretary said. Updates on contact tracing and details of the new cases from cases number 7 to 10. All cases reported yesterday are stable and still admitted at the different hospitals, specifically at the Makati Med for our patient number 7, from St. Luke's Medical Center Global City for our patient 8, the Medical City for our patient 9, and St. Luke's Medical Center Quezon City for patient 10 respectively. DOH also reported that patient 7 is a foreign national with no residence here in the Philippines, while patient 8 is a resident of Pasig City, And patient 9, on the other hand, is also a foreign national with residence in Marikina City, and patient 10 is a resident of Quezon City. As of 12 p.m. today, the Epidemiology Bureau of DOH has identified a total of 468 contacts of patients 4 to 10, of which 113 have already been assessed. 107 interviewed contacts had been placed under home quarantine, while 6 had been categorized as patients under investigation and placed under isolation at various health facilities. DOH urges all individuals who will be contacted by surveillance teams to fully cooperate in the investigation and contact tracing activities. Individuals with known history of known exposure to a positive patient and/or history of travel to areas with local transmission with mild symptoms such as fever, dry cough, fatigue, productive phlegm, sore throat, headache are advised to self-isolate and be home quarantined for 14 days. Those presenting severe and critical symptoms need to be immediately admitted to health facilities. They are urged to get in touch with DOH and call the designated hotline at 028-651-7800, local 1149 to local 1150 for appropriate management and referral. In light of the new confirmed cases, we reiterate that the best way to prevent getting infected is to practice personal preventive measures such as proper hand hygiene, social distancing, and cough etiquette. As much as possible, let us also refrain from visiting public places and/or attending mass gatherings. We should continue to be vigilant, and I call on everyone to cooperate with DOH for us to hurdle through this crisis together, the health chief concluded.
Okay, thank you, ASEC. We will now be accepting questions. We are pressed for time. ASEC will be attending the IATF at Malacanang, so we will only be able to accommodate a few questions. Let's try to limit our questions to, let's try to limit our follow-up questions also. Let's start with Sir Rafi, and then Ma'am Aiko, and then si Joe.
Good afternoon, ASEC. Given that there are now rising number of cases of COVID in the Philippines, do we have enough in terms of bed capacity for the quarantine facilities, because we understand that they need to be isolated right now. So do we have enough in case we now start to see clustering in different areas?
Yes, Rafi, no? Thank you for that question. Para lang po malinaw sa lahat. Ngayon kung nandito na po tayo sa estado na ganitong meron po tayo nakikitang localized transmission, yun pong ating strategy for quarantining persons is we are now transitioning to having this home quarantine para sa mga individual, especially for those mild cases, para po hindi napupuno ang ating mga hospital facilities. Quarantine facilities na sinasabi natin, katulad ng New Clark City, ay hindi natin masyado ng hindi na natin masyadong magagamit sa ngayon, no? Because our strategy is being redirected into this early detection, isolation, and management of cases because of our level of alert this time. So ngayon po, yun pong ating mga nakikita, no, na mga tao na may nag-exhibit ng simptomas, may history of known exposure or history of travel to this local, with local transmission, ay na-advise natin ng home quarantine kung mild lang naman po ang mga simptomas. Ngunit kapag severe, yun po ang pinapadala natin ngayon sa ating mga referral hospitals.
Bed capacities, ma'am, ng mga ospital, especially yung isolation areas nila.
Matagal na ho natin pinaghandaan to, no? Actually, pinagplanuhan at pinaghanda ang ating mga hospitals, especially our government hospitals, for these isolation rooms. In case that surge capacity nga po ang ating ipapatupad, where yung kanilang original bed capacity ay may exceed nung ating sitwasyon ngayon. So meron po tayo, sa ngayon, existing, it is enough. Titignan po natin sa darating na araw kung paano natin matutugunan kung sakaling ma-exhaust po itong ating mga sistema natin, no, for our hospitals.
Last question na lang po from my end, ma'am. Yung mga symptoms ng COVID, ma'am, how do we differentiate this from the normal, ordinary trangkaso? Because is there any symptom that is unique to the coronavirus? Kasi meron mga nakakaranas ng shortness of breath, difficulty breathing. Is this also present in other illnesses?
Sa katunayan po, no, katulad sa pagkakaalam nating lahat, ito pong coronavirus have similar signs and symptoms with other flu viruses that we have right now. So, halimbawa po, nakakaranas ang isang tao ng pananakit ng kasukasuan, masakit po ang ulo, nilalagnat, may sore throat, may ubo, may sipon, maaring meron siyang kapareho, no, na iba pa hong mga flu or viruses na nag-exhibit din ng ganitong simptomas. So wala ho kami maibigay, not unless po pumunta na tayo sa ospital, magkaroon ng diagnostic procedures, because there had been experiences and reports na sinasabi ngayon na through x-ray makakakita ka ng patches, may makikita kang fibrosis and the other observations. Pero kapag simptomas lang, titignan mo lang ang pasyente, clinical eye, makikita mo, kapareho lang po siya ng mga simptomas ng trangkaso.
Ma'am Aiko, and then si Joey, and then Ma'am Kiri.
Hi ma'am, just like to get the profile of the case 11 to 20. How are they related to the additional cases reported last night and this morning?
So sa ngayon po ma'am, wala pa po tayong maibigay sa inyo na informasyon tungkol sa relation, tungkol po sa linkage. Kailangan po pa natin ng kumpletong informasyon ng ating mga nakuhang additional cases para masabi po natin itong informasyon na to if they are really epidemiologically linked, no? Kailangan pa po natin gawin yan. Just to say that we are now getting all the information kasi kanina lang po namin nakuha itong pong mga positibong resulta before lunch, no? Itong mga resulta. So, atin na pong pinalabas ang ating mga teams para makapunta sa mga pasyente para makapag-start tayo ng contact tracing. We will give you the information in the next few days.
Ma'am, a recommendation or an option of the implementation of the protocol dahil dumadami yung cases natin is lockdown. What will trigger the possibility of the implementation of lockdown now that we have the code red alert sub-level 1?
Yes, ma'am. Ang ating lockdown na tinatawag, no, yung sinasara mo yung isang lugar at hindi ka nagpapapasok o nagpapalabas. That is lockdown. Yan po ay isang strategiya na nakapasok doon sa ating sub-level 2 ng Code Red Alert. So ngayon, nasa sub-level 1 po tayo. So wala pa po tayo doon sa estado na kailangan na natin mag-lockdown. Pag nagpunta po tayo doon sa sub-level 2 ng Code Alert Red natin na tinatawag, dito po ay meron na po tayong sustained community transmission. Yun po yung ating trigger para magsabi na pwede na po tayong gumamit nitong mga strategic interventions na ito katulad ng lockdown.
Ang babawiin po ba yung naunang memo from different government agencies na magkaroon ng public gatherings? Will the IATF issue another order to not to encourage the public to attend public gatherings?
Hindi naman natin babawiin, no? Pagka naiutos na ng isang ahensya, ay nandyan na yan. So pag lumabas na ho ang ating IATF resolution mamaya kung saan isa sa agenda ito, no? Yung kung ano po ang pwede nating magawa for us to prevent further spread, kung ano po ang pwede nating magawa para ma-contain pa as much as possible, pag-uusapan lahat mamaya sa IATF. Ngayon po, as we speak, magkakaroon na ng meeting at mamaya lang pong gabi magkakaroon ng resolution regarding this and we will be providing you with updates. So wala tayong babaguhin, magkakaroon lang ng resolution which will rescind the previous issuances of other government agencies.
Okay, let's try to limit our questions to one to give everyone a chance to be able to ask their questions.
Ma'am, may we know kung saan localities po yung cases 11 to 20? And because pwede ba natin siya specify lang to a certain community because there are concerns, especially in social media na lumalabas, na kung saan-saan ng barangay dinidirect itong mga patients na to, na dito daw nanggaling yung patients, para lang malinaw sa publiko kung saan ba lahat na nalulocate itong mga patients na to. Because there are also posts on social media na ina-identify na yung mga patients na to.
Kami po ay nagbigay, no, na kung nasaan. Like for patients 7 to 10, binigay mo kanina yung lokasyon ng ospital at kung saan yung ospital na kung saan naka-admit yung ating mga pasyente. And then afterwards, our local government units had their press call and they gave the information for each of their patients. So ganun din po ang magiging protocol natin ngayon. Ang ibibigay ko namin sa inyo kung nasan sila mga ospital. And with regards to their residents, which actually hindi pa ho namin ako kompleto informasyon dahil kakakuha lang namin ng informasyon, so mamaya po makukuha namin completely. But as I've said, let's have that protocol where we say and we give media the information on what specific hospitals they are. And with regards to their place of residence, specific addresses, and what the LGU are doing, no, for interventions. Ang local government po, may usapan na po na pagkatapos po makapagdeklara ng DOH, sila naman po ay maaari mag-hold ng press conferences.
Okay,
Isa na lang on my end. Meron na ba tayong information kung bakit dumoble ng ganito karami? Initial information on bakit dumami ng ganito agad yung mga cases natin. And yung sa case number 5 natin, ma'am, na-determine na ba natin yung possible source?
Case number 5 is the very reason why we called for localized transmission. Kasi wala siyang history of travel, wala siyang history of known exposure apparently. Kaya tayo nagdeklara ng localized transmission. Hindi pa rin mo natin nakikita based on our contact tracing kung saan talaga nakuha ng ating case number 5 or patient number 5 itong kanyang sakit, no? So yung biglang pagdami po ng kaso, ito naman po ay dahil sa pag-igting na surveillance na ginagawa nga natin sa ngayon at nakakakita na tayo ng mga tao, no, na nagpo-positibo dito sa ating bansa. And if you may observe, some of these positive cases had histories of travel galing from countries which are affected.
Hi, ma'am. Good afternoon po. Ma'am, my first question is, gaano karaming test po yung currently na kayang gawin ng mga testing facilities natin? And ilan po yung ina-expect natin na darating from WHO?
Yes, ma'am. Sa ngayon po, ang ating Research Institute for Tropical Medicine is our National Reference Laboratory. Ito po ang nagtetest ng lahat ng meron tayong ginagawang test for COVID-19 sa ngayon. They have that capacity of testing about 300 samples per day. At meron po tayong padating na donasyon galing sa World Health Organization ngayong linggo, no, na isang another 1,000 kits na ibibigay na 1,000 last.
Ma'am, clarify ko lang po kasi magkaiba po yung data na nabanggit sa Malacanang and sa Senate. Sa Malacanang, ang nabanggit po is may existing na 4,500. Tapos sa Senate naman po, over 2,000. I just want to clarify the numbers po.
The one in Malacanang that we have stated would be the original na meron tayo na exact inventory na 4,500. But because of this surge in the number of cases and the number of people who wants to have themselves tested, no, na pumunta sa ospital at na-qualify naman po doon sa ating criteria, ay naging ang ating existing stocks ngayon ay a little above 2,000 na lang. So baka po yun ang binabanggit ko.
Ma'am, last.
Okay, let's leave another questions. Si JC mo, sir. And
Ma'am, sino po yung supplier ng WHO on the test kits? Hindi ba information on this po?
I don't have that information now. We'll give it to you.
Tapos ma'am, you may study daw po about doon sa dapat bang iwasan na raw yung paghawak daw po sa mukha dahil po sa possible po ba na magkaroon ng COVID because of this?
Dati po yun, sir, kasama po yun sa ating precautionary measures. Sinasabi nga po nila, because we have mucosa sa ating bibig, sa ating ilong, sa ating mata. So kapag ikaw ay nakahawak, for example, ay bumahin ka or ang isang katabi mo ay bumahin, nakipag-shake hands ka, pagka-shake hands mo sa kanya, hindi ka nagugas ng kamay, hinawakan mo yung mata mo, hinawakan mo yung ilong mo, hinawakan mo yung bibig mo, maaari kang mahawa. So that's it. And then there are now studies na pinapatotoo ito. No? So may isang study kaming nabasa ng isang araw kung saan pinag-aralan ng researcher yung mga isang grupo ng mga medical students. And they found out na ang laking porsyento, no, parang, hindi ko na matanda yung exact figure, parang nagpo-point out na almost 90% of these medical students touch their faces often and more than na dapat na tinatouch mo yung face mo in a day. So makikita mo talaga yung behavior ng tao, kailangan mabago para maiwasan ng sakit eh.
yes, sir.
Hi ma'am, good afternoon. Ma'am, 2 questions lang po. Yung isa po, yung can we consider na po, yung considering na in a day net double po yung figures, can we consider na meron po tayong community transmission? If not, when do we say that we have community transmission?
Yes, hindi pa po. Hindi pa tayo nag-consider. Unang-una, kailangan natin ng kompletong impormasyon para masabi natin kung tayo ay may community transmission. The main determinant para masabi mo may community transmission ka kapag ang mga kaso mo ay hindi na linked to each other. No? So, kaya nga po inaalam natin lahat itong mga kasong ito sa ngayon para makita natin if there are linkages between and among all of these positive cases that we have. Once we find na pag na-analyze na ho natin, na kompleto natin ang informasyon, once na makita natin na meron kahit isa na walang link dito sa 20 natin na mga kaso, then we can already, this will trigger the declaration of sustained community transmission.
So sa ngayon ma'am, clarify lang, may possibility sa ngayon, if you're looking at it, if meron na nga.
Base sa datos, hindi ko pa masasabi.
Apo.
Pero of course, we are saying, no, dati pa natin sinasabi, merong posibilidad yan. Pero base sa hawak kong datos ngayon, hindi ko pa masasabi.
Isang tanong na lang po. Yung magsa-summer na po kasi, yung po bang pag-swimming in public, is it safe?
Oh well, pag sinabi mong swimming in public, it depends on how many you are inside the pool. Diba? So kung makakasalamuha mo ay 100 kayo sa loob ng swimming pool, ay sa tingin ko delikado. Ngayon, kung dadalawa lang kayo at you remain to have that distance, siguro naman po ay mababa lang yung risk natin.
Okay, last 2 questions.
Ma'am, at sa premium po, ma'am, ang tanong ko lang, kalibat ka na ng mga LGU ng TF, nagsususpend ng screen. Is it right? Tama po ba yung ginagawa nila? And the second question, ma'am, yung punta na yung summer, ngayon, lumalabas na balita sa Facebook na hindi daw nabubuhay yung COVID sa summer weather.
Sige sir. Ang una po, yung ating mga eskwelahan. No? So hindi ho natin pipigilan ang mga local government, yung kanilang mga kabataan sa lugar, ay may risk for that. So pero siyempre, gusto rin pa rin natin that there is this proper guidance and coordination with them para lang maiayos po natin itong class suspension. So ngayon, naka-agenda po ito sa ating interagency task force meeting para pagdesisyonan ng high-level officials ng mga bawat ahensya ng gobyerno. Kasama po ang DepEd at may rekomendasyon na pong ibibigay ang Department of Health regarding this. So antayin lang po natin mamaya may resolution tayo para po mas guided po tayong lahat at meron tayong we are backed by evidence when we suspend classes. Yun pong tungkol doon sa init, marami na hong nagsasabi tungkol dyan. No? Pero pag tinignan natin, meron naman ibang bansa na mainit din, pero mataas ang kaso. So ang ibig sabihin po, hindi ko sinasabi na mali o hindi totoo, hindi ko rin sasabihin tama. Kailangan pa muna natin ng mas maraming pag-aaral para ma-prove natin at magkaroon ng ebidensya na totoo nga po yan na ang virus na ito ay namamatay sa init ng araw.
Okay, thank you, Asik. That concludes our...
I have one question.
Bigyan, last question.
Okay. Asa kailan po dapat magpatingin? Kasi kung may reports po na marami nang gustong magpa-check up kapag may kaunti lang na nararamdaman.
Sige, thank you, no? Gusto namin klaruhin yan nung isang araw pa kasi nabalitaan namin na halos ang dami ng mga tao na nag-flock ng ating mga facilities ngayon, yung ating mga ospital para magpa-test. Ang lagi ho nating tatandaan, ganun pa rin ho ang susundin natin na criteria based on our decision tool. Kung ikaw ay may simptomas na related sa COVID-19, plus may history po kayo ng travel to affected areas or those with local transmission, plus or exposure to a positive case. So, halimbawa po, ako po ay pumunta sa isang bansa na may local transmission, o umuwi po ako dito, tapos nakakaramdam ako ng sintomas related to COVID-19, pupunta ako sa ospital, itetest nila ako kasi pumasok ako dun sa criteria. Or halimbawa, ako ay naging kaopisina ng isang may positibong kaso at I had direct interaction with him, tapos nag-exhibit ako ng signs and symptoms, pag pumunta ako sa ospital, ako itetest nila, nag-qualify ako sa criteria. Ngunit, yung mga tao na nakakaramdam ng parang tinatrangkaso sila, or nakakaramdam ng simptomas related to COVID-19 pero walang history ng travel sa ibang mga bansa na may localized transmission o di kaya walang history of known exposure to those positive cases, ay hindi kailangang mabahala, mababa ang risk nyo. Ang kailangan lang gawin, mag-monitor sa bahay ng kanilang mga sintomas. Pag nag-progress ang kanilang sakit, tumawag sa kanilang doktor o di kaya magpatingin. Pero hindi agad-agarang kailangang i-test ang mga tao.
Ma'am, paano ma'am kung halimbawa hindi niya kilala ma'am yung isang confirmed case? They work in the same building pero hindi niya po alam na yun pala yung confirmed case.
Kaya nga po sinasabi natin, i-monitor niyo yung sarili sa bahay. Tapos pag nag-progress po ang mga sintomas, that's the time. No? Halimbawa, nilalagnat ka isang araw, okay, walang history of travel exposure, pero pagdating 4 na araw na nilalagnat pa rin, magpa-check up tayo, baka may ibang sanhi, no? Or ibang reason kung bakit ka nilalagnat at hindi naman talaga COVID-19. And still, we practice our precautionary measures.
Okay, ma'am. One last question.
Update lang po dun sa case 4, 5, and 6, unlike 5 po.
Yes, updates for patients 4, 5, and 6. Patient 4, yung 48-year-old male po, siya po ay in stable condition, still in our referral hospital. Patient 5 is a 62-year-old male. Siya po rin po ay nandun sa ating referral hospital, stable but guarded. Dahil meron po siyang ibang mga karamdaman. Yung isang araw po napabalita na ililipat natin siya sa another facility because of another procedure. Kaya lang po hindi tayo natuloy sa paglilipat dahil nagkaroon po ng medyo desaturation yung taong ating itatransport na ibinalik doon, and he's now doing this procedure doon sa original referral hospital natin. Hindi na ho natin siya nailipat. Patient 6, the wife of the 62-year-old male, siya po ay in stable condition and still inside our referral hospital.
Okay, that's it for our presentation for today. For more information, stay tuned to DOH's official channels. See you all again on our